Welcome to our first ever virtual fall event. I'm Say Baylog, Human Options Teen Ambassador. You might be asking yourself, what is a Teen Ambassador? Well, we are part of a special prevention effort at Human Options that involves a 10-week program designed to educate and empower all of us about the signs of dating abuse, how to get help and prevent it, and what healthy relationships look like. We want to ignite social change in our schools, neighborhoods, and beyond by bringing awareness to teen dating abuse, how to recognize it when you see it, and how to protect yourself and others from experiencing it. In fact, I'm wearing purple today in support of Domestic Violence Awareness Month and have posted my selfie with the hashtag #PledgePurple. Join me. I could probably talk all day about the Teen Ambassador program and all that I've learned, but it's time to start the event. Let's kick things off with a short video showing human options in action in our community. Roll the clip.
Coronavirus pandemic can have a negative impact on a lot of relationships, and in some cases, it's led to domestic abuse.
And joining us right now is Maricela Rios-Faust, CEO of Human Options, a relationship violence prevention organization based in Orange County. Maricela, thank you so much for being with us.
Thank you so much for having me. Good morning.
Good morning to you. Yes, in general, how would you say this pandemic has impacted domestic abuse?
Well, really, in general, it's taken an issue that is already thriving in silence and pushed it further into the shadows. It really creates a situation where women, children, and families and men who are affected by abuse are not safe because there's nowhere to go and they're feeling much more isolated than during the normal times.
Every 9 seconds, a woman is victimized by domestic violence.
February is Teen Domestic Violence Prevention Month, and here with tips to help young people develop healthy relationships is Maricela Rios-Faust, CEO of Human Options. How prevalent is it? Is it something that we are seeing more of?
It's actually very prevalent. It's 1 in 4 women are abused by their significant other and 1 in 7 men. It's a very prevalent issue that needs to be talked about more frequently.
Are teens at higher risk?
Teens are definitely at higher risk. They're at an age where they're vulnerable. They're seeking some sort of appraise and their validation, and so definitely we see it more frequently. It's 1 in 3 teens are victims of domestic violence or relationship violence.
Ending the cycle of domestic violence, victims often have a hard time opening up about it. Now hairstylists may be the new frontier in the battle against abuse.
Once they warm up to you, you just never know exactly what you'll hear from them.
But what if that includes the often taboo subject of domestic violence?
I hear a lot of victim survivors. I don't let anybody touch me, but I let my hairdresser touch me. Because there's this sense of safety, isn't there?
Experts at Human Options are training beauty professionals on what to look for.
You might notice their mood changes drastically. You also might notice that they are very quick to want to get the appointment over with because they feel rushed.
Presley says these workshops are the first step in recognizing signs of abuse. The next step is encouraging someone to ask for help.
Hi, I'm Carly Sanchez, another teen ambassador, and I'm taking what I learned from ambassadors and igniting social change here in Chicago, where I'm now going to school. Wow, that was a great highlight reel of our community impact. I'm so glad Say got to tell you a bit about teen ambassadors. You know, part of the Teen Ambassador program is a service learning project. Mine was creating a teen conference in my community for teens to learn all about teen dating abuse and healthy relationships. It was a wonderful experience for me to work along such dedicated youth, and overall it was a very empowering event. Now I'm taking what I learned out beyond Orange County. You can make an impact too. Take that selfie wearing purple with the hashtag #PledgePurple. Let folks know you're with us today and standing against domestic violence. Now it is my pleasure to introduce our event chair, Katie Nunez, and Human Options CEO, Maricela Rios-Faust.
Thanks, Carly. I wish Human Options had the Teen Ambassador program when I was your age. What a great foundation for building healthy relationships in your life and helping others to do the same. Good afternoon, I'm Katie Nunez, and I have the great pleasure of being today's event chair. With me, I have the pleasure of being with Human Options CEO, Maricela Rios-Faust.
Hi, everyone.
We want to welcome all of you to our first ever virtual event. You know, Maricela, ever since I was a young girl, Human Options has held a special place in my heart and my family, which I'll get to a little bit later. But in the meantime, we have a lot to cover. So Maricela, I'll kick it over to you.
Thanks, Katie. Hi, everyone, and thank you for being here. As you can tell, this is a very different event than what we're used to. We're used to being in a big room with you, seeing all the purple, feeling the energy and the love. And so this is extremely different. We're here at the emergency shelter in the children's program, trying to bring to you the backdrop that we want to tell a story and a narrative on, which is essentially how the pandemic is impacting our families and our children. Really thrilled to have you all be a part of this. Excited to have you learn a little bit more about the ambassador program. You've seen our wonderful ambassadors so far. You'll see them throughout the show. Carly and Say have been amazing. So excited that this is an opportunity to showcase them. I also want to take a moment and thank our sponsors, our platinum sponsors, the Jaffe Family Foundation, our silver sponsors, Karen and Scott Green, Hoag Hospital, and Barbara Roberts.
And we'd also like to thank our bronze sponsors and our advocates for social change and ambassadors for social change and all the donors. Thank you.
I also want to take a minute and thank our incredible board of directors. Thank you for your leadership and your vision and all of the work that you're doing to ensure that we can fulfill our mission during this time. Huge thank you. I also want to thank the amazing team at Human Options. We could not be doing this without you. You're incredible, and thank you for everything you do every day.
Yes, thank you to all of our wonderful sponsors. Your support is so vital. And I can't forget to thank our incredible event committee, and I want to say thank you for all of your support. Your enthusiasm and commitment to making today's very unique event was instrumental in its success, and I could not have done it without you. Of course, this event is not only happening to give all of us the opportunity to hear from our California Surgeon General, but also to hear more about Human Options and why it's so important to help this organization right now. At the top of your screen, you can find ways to donate through text to give, online, or by phone. Our goal is to raise $250,000 today, and we are well on our way thanks to all of your sponsors. $250,000 will help 125 families in the next 90 days to escape domestic violence and give them the hope for a better violence-free future. Maricela, I bet we can both agree that Dr. Burke Harris is the right speaker at the right time. Just like us, she's passionate about creating a safe, stable, nurturing space for children to grow and thrive into healthy adults. Right now, creating that safe environment is even more difficult, but more important during the pandemic. Maricela, what is Human Options seeing during this time, and how have you been able to adapt?
Well, Katie, as you know, the domestic violence is not new in the COVID-19 pandemic. What it's essentially done is it's creating a more difficult and challenging time for victims and survivors of domestic violence. It's putting them in a situation where essentially really illustrating being at home is not safe. It's put them in a situation where they can no longer reach out to someone and get the assistance that they need. I think it's wonderful to be here at the emergency shelter because we have an opportunity to share with you the dramatic impact it's having. In 1 week, our calls more than doubled, which is incredibly difficult. There were calls for legal advocacy. We had fathers trying to essentially keep their children away from their parent, saying that they were going to harm them. We also, in a 1 week span, had 5 families enter our emergency shelter, 3 of which were strangulation. For those of us that are doing this work every day, we know it's hard for a woman to admit that strangulation occurred. They tend to minimize. And so we know that that's pretty dramatic, and a lot more is happening in those homes. Just to get to our emergency shelter, what we were noticing is as people were calling, many of them would make the call. It was probably the first time they got to get away and make a call, and then didn't get to do anything else. We had one woman who essentially said her husband had trapped and set traps around the house in a way where if she tried to leave, she could hurt herself. Her final escape the day she left. She went skidding across the kitchen floor because he had layered the floor with water. got to the door and got help from a neighbor. It's been so critical to have the community support, watching out for one another, reaching out to one another during this time. This luncheon is another attempt to get the information out, to get all of you as ambassadors in our community to be able to connect someone and support someone who's being victimized. We hope you enjoy the luncheon. Say, back to you.
I hope you all have noticed the opportunities to donate that have appeared at the top of your screens during this event. Please take a moment to make a gift today to help us change the lives of a family. As was mentioned earlier, our hope is to raise $250,000. Over the next 90 days, that amount can give 125 families a chance to escape domestic violence and build a stronger future for those children. Don't worry, you can click the button to donate and still keep this event up on your screen so you won't miss Dr. Burke Harris. To give you a real-life example of this work, take a look at this clip from ABC 7 News, which is a great example of what Human Options is doing to heal and prevent childhood trauma.
Well, we are told Santa Ana has the highest number of domestic violence calls in Orange County. Today, a woman who survived abuse spoke to Santa Ana high school students about it and the resources available to stop it and get help. Orange County reporter Tony Cabrera has the story.
Students at Santa Ana High School are learning about domestic violence from someone who witnessed it in her own home and was abused herself.
Yes, my father raped me, but those statistics are common when you grow up in domestic violence. Little girls who grow up in violence are 10 times most likely going to be raped by the perpetrator.
Human Options. They teach on why dating abuse happens, why victims stay, and the resources that are available, all in hopes of breaking the cycle.
They've told others but haven't been believed. So my role, not only as a mandated reporter, but as a humanitarian, is to believe them, to get them hooked up with all of our Human Options resources.
And in Santa Ana, there's a need. According to the police department, last year alone, they received more than 5,300 calls for domestic violence. In the same year, 3,035 reports were taken for it.
Santa Ana gets the most domestic violence calls out of any city in the county, which is really unfortunate.
The observation of violence at a young age has a huge imprint on the person, both female and male. And it's a predictor that's found in prisons.
Statistics that have students here taking it seriously.
It's happened in my family, so she was talking to me about it, and I really like what she was telling me, so it's kind of motivating me more to keep on going with the process.
If Santa Ana is like the #1 of like domestic violence, then I think everyone should be aware and like know what to do.
If you or anyone you know is experiencing some type of abuse, you can call Human Options, their 24-hour hotline at 877-854-3594. In Santa Ana, Tony Cabrera, ABC 7 Eyewitness News.
It is my pleasure to introduce Marissa Presley, our prevention educator and teen ambassador mentor. She is a great example of the passionate staff at Human Options. Marissa has been a huge influence in my life. She has invested in me as a person and has taught me so much about myself and the power that we as people have in our voices. I admire her for her persistence and bravery. She is a great leader, and I feel honored to be able to look up to her.
Hi everyone, thank you so much for joining us today. I am Marissa Charlotte Presley, Prevention Education Specialist here at Human Options. Thank you, Carly, Ambassador, for that wonderful introduction and for sharing that wonderful clip from Santa Ana High School. We usually ask a survivor to come and share their story with you, but today I'm going to share with you the story of Lorena and her 3 children. And the reason I'm going to share it with you is because although Lorena has made the courageous effort in leaving her abusive marriage, her life is still in danger, and the person who's harming them could still find them. Lorena entered our shelter after witnessing domestic violence as a child, and that resonated with me when I chatted with her because, you see, both of us witnessed our mothers being brutally beaten. Both of us had our first pregnancy at age 15, and that's actually quite common for children who grow up and witness domestic violence at home. Both of us also grew up in the same city. So I hope that today I honor her story. Lorena told me that the reason why she called the hotline was because she couldn't get the look of her children's eyes out of her mind. It was the look of fear. Fear of the violence that they were witnessing. They witnessed not only physical violence, but verbal abuse and mental abuse. Lorena told me that it was the mental abuse that she believes was the most harmful. When her and her children entered the shelter, they carried with them the signs of trauma, from anxiety to depression, As a matter of fact, Gary, her firstborn, at only 6 years old, had thoughts of harming himself and suffered from depression and anxiety. The twins, Brian and Alan, they both carried trauma as well. Brian was aggressive, beating up on his mother Lorena regularly when he was stressed or didn't get his way. And Alan, he also suffered. He acted like the perfect child, and his confidence level was very low. Through work with our program staff, they all learned ways of healthy communication, and Lorena, she was able to retake her parental role, and she did that with confidence. And also, to credit Lorena, through her resiliency and throughout all of the obstacles with COVID-19, she was able to secure affordable housing. Her employment prospects are bright. And the best part of this story is that her children, all three of them, are thriving. They're participating in sports such as basketball and soccer. Thank you so much, because now you know why we do the work that we do. I'm going to turn this back over to Marisela and Katie. Peace, love, and harmony to all.
Thank you, Marissa, for telling us the story of Lorena and her boys. It's terrible to think all of the scary things that they saw at such a young age, and I'm really grateful that they were connected with Human Options. I feel really lucky because I grew up in a healthy and safe environment. My grandmother, Ann Wright, in 1981, was one of 4 women that founded Human Options. And so actually growing up, I would go to the shelter with my grandmother, my mom, and my sister, and was able to see a lot of the children and families that were positively impacted by Human Options. We'll be celebrating 40 years of Human Options next year, but sadly our reason for being here has not changed. In fact, as you've heard, domestic violence has surged during the pandemic. As we're about to hear more from Dr. Burke Harris, how the trauma happening now to families and children will unfortunately be felt long into the future. So what we do today can change the future for families asking for help from Human Options. Our goal is to raise $250,000, and we're well on our way. That amount will help 125 families in the next 90 days escape domestic violence and build stronger families, ensuring them a better violence-free future. Thank you to all of our generous donors. We're currently at 75% of that goal. So today, each of you can help us change the lives of families like Lorena's and make a gift to Human Options. To encourage you to make a gift, we have a group of friends who have come together to offer a $10,000 challenge match. That means that every gift made today will be matched dollar for dollar up to $10,000. So here's your chance to double your donation. Every single gift makes an impact. Every gift can change a life. And there are 2 ways you can donate. You can text Human Options, which is one word, to 50155 or click on the link at the top of your screen. While folks are making their gifts, thank you, I wanted to ask you more about how children cope when living in a home like Lorena and her boys.
Yeah, thanks, Katie. That's such a great question. It's a good opportunity to really kind of highlight what happens. Many children will cope in a variety of different ways. Some of them will actually withdraw. They'll get much more quiet. Some will act out. Some will have night terrors. So in the middle of the night, they wake up screaming. Some will not be able to sleep. Their eating habits will change. And so you'll start to see that. You know, I think what's interesting is if left unresolved, I've had the privilege and opportunity to really talk to a lot of adult men and adult women who have experienced it. And the ones that have really stuck out to me have been actually the young boys and the young men who have grown up. And the reason that stuck out to me is really because the way they tell their story, right? It's really about, you know, I watched my mom be abused and she never did anything. And so there's also some like, as if they're disappointed that their mom couldn't do something. Sometimes it's more about, you know, I just couldn't take it anymore. I kept talking to her about doing this and she wouldn't leave and she wouldn't leave. And so finally, when it got so bad that because she wouldn't leave with us, I left the house. And it really robbed them of having a relationship with their adult parent. Those are some of the things that, like, if left untreated, if left without the intervention, we're seeing the long-lasting impact that has. It's an anger, it's a sadness, it's something the person carries with them for a very long time that they haven't been able to work through.
Wow, this is terrific. I just got some news on some of the donations that are coming in. Thank you for all of your generous support. Melissa and James Leisure, $2,000. Thank you for that wonderful gift.
Thank you, Julie Hill, for your $2,000 gift.
$500 from Sandy Jackson. Thank you.
Lesson Ellen Thomas, thank you for your $3,000 gift.
Arden and Max Gardner, thank you for your $1,000 gift.
$500 from Ann Crane. Thank you.
Martha Ryan, for your $1,000 gift. Thank you.
Atlas Partners, $500. Thank you.
$1,000 from Kathy O'Neill. Thank you so much.
Sue Parr, thank you for your $500 gift.
Well, it looks like we're still seeing a lot of gifts come in, $100, $25. Every dollar counts, so thank you so much.
Thank you, Diana and Peter Robertson, for your $1,000 gift.
Delos Capital Management, $500. Thank you.
Brighton Park Capital, thank you for your $500 gift. Thank you all for your generous donations and your support of our mission. We could not do this without you. As you know, this has been an incredibly difficult time in which families are really doing their best to survive until they get an opportunity to leave the abusive relationship. What we've really relied on is a virtual platform, our opportunity to use Facebook, and a number of different environments in order to get the message out, including media. We've been, as you could tell from the beginning, we've had a lot of great opportunities to get on the media and get the story out so that the individuals who are experiencing violence know they can escape. Another person in Hollywood who's also helping get the message out is UN Ambassador Angelina Jolie. Here's a clip of her interviewing Dr. Nadine Burke Harris.
So many people don't take trauma seriously. They hear trauma and they think it's something you can choose to overcome. You can open yourself up. You can relax into it. You can be forgiving of something that happened. But they don't understand how it's really affected you, so they don't treat it, and then we don't have strong treatment for trauma
That's
care.
Right. There are a lot of people who think that trauma is hurt feelings, right? And that if you pull yourself up by your bootstraps, you can just choose to get over it, right? And what I think that doesn't recognize is that when we're exposed to high levels of trauma and adversity, and especially during the critical years of childhood when our brains and bodies are developing, that releases stress hormones like adrenaline and cortisol, and that has biological impacts on our bodies. So a child who has experienced 4 or more adverse childhood experiences, and that includes, being victim to abuse or neglect, or growing up in a household where there's parental substance dependence, incarceration, domestic violence, where there's parental separation or divorce or parental mental illness.
And now it is my great pleasure to introduce our main event. We are very excited to have California Surgeon General, Dr. Nadine Burke Harris, with us today, along with Senior Editor at the Southern California News Group, Samantha Dunn. Sam, thank you so much for agreeing to return this year to be our moderator. Dr. Burke Harris, I know everyone here at Human Options is a huge fan and understands the great importance of your work and to end childhood trauma. We see the impact of childhood trauma every day in our work. Sam, I'm going to hand things over to you, as I'm sure our audience wants to hear more from Dr. Nadine Burke Harris.
Dr. Burke Harris, it is such a pleasure to meet you, if only virtually.
Well, the pleasure is mine. I'm really happy to be with you today.
Well, wonderful. Listen, we've got a lot to cover, so let's just jump right into it, okay? As I told you before we got on earlier, I am such a fan of your book. And when you began working at the Bayview Child Health Center in San Francisco, you quickly discovered something wasn't quite right. Can you take us back to that and how you came to understand the importance of ACE screening?
Yes. Well, in my experience as a pediatrician, what was happening was I was seeing so many patients who had, lots of different health challenges. And when I did what we're taught to do, the history and physical, what I was hearing in the history was so many patients who had experiences of adversity, and it was just coming in snippets, little things that just kept on accumulating in the back of my mind. But I will tell you one that I will never forget. I had a patient I was treating for asthma, and as I sat down with her mom and said, okay, I've given her powerful medicines to try and keep her out of the hospital. Which of her asthma triggers could we possibly be missing? We've tried, we've looked at pet dander and cleaning products and, all the different things. We worked really hard on it. And I'll never forget what this mom said to me. She said, doctora, I noticed that my daughter's asthma tends to act up every time her dad punches a hole in the wall. And that really, for me, it was those stories and those connections that really got me diving into the science about how early adversity affects the developing brains and bodies of children. And that's really what brought me into, the science of coming across the ACE study, learning about ACEs, learning about toxic stress, and most importantly, learning about what we can do to interrupt that process.
Now, before we go any further, how do we define that toxic stress, that trauma? What goes from being a negative experience into something that is really toxic and chronically damaging?
That's a great question. So, what we understand and what the science tells us is that when we experience anything stressful, right, our bodies release stress hormones, and that's normal. But what we see is that especially when children are exposed to repeated stress, intense stress, chronic stress, that these stress hormones that are designed to save our lives if we are in a threatening or scary situation, they get released and activated so often that the stress response can actually become dysregulated. It can become overactive. And it's the overactivity of the stress response that's associated with changes to the structure and function of children's developing brains, their hormones, their immune system, right? Even the way DNA is read and transcribed. So all of those long-term changes that happen in the body, the overactive stress response and all of the changes to the brain and body as a result is what is now known as the toxic stress response. But one of the things that we know is so important, and it's the hopeful piece that really keeps me in this work, is the understanding that biologically we have the ability to buffer each other's stress response, right? Especially especially as parents and caregivers, but any trusted, caring adult, through the presence of safe, stable, and nurturing relationships and environments can actually help to counteract that stress response and protect children's developing brains and bodies from this overactive stress response.
So it's relationships and consistency, no matter what quality, as long as it's loving. As long as it's loving.
That's right. Safety, stability, nurturing, all of these things are the key. And the thing about it is that, the research shows, like the thing I get excited about is the research shows that when we do that, like for example, as a mom, my husband and I have 4 boys. And when something scary or stressful happens with one of our boys, the first thing I do is throw my arms around them. And it doesn't just make them feel better, it actually releases oxytocin in their bodies, which biologically interrupts the stress response. And that's what these, safe and stable and nurturing relationships do. They're healing.
Wow. We'll get back to that a little bit, but I want to ask, circling back, what if it goes unchecked? What are its effects into adulthood?
So that was the really groundbreaking research that came out of the ACE study that was done by the CDC, the U.S. Centers for Disease Control and Prevention, and Kaiser Permanente, one of the largest healthcare organizations in California. And what they really found was that the more of these, the more cumulative adversity, the more categories of adversity someone experiences in their life, the greater the risk for not just things that we kind of intuitively understand, right? So things like mental health disorders like depression and anxiety, or suicidality or substance use. We do see that really strong relationship, but also things that folks hadn't really realized before, like some of the leading health conditions that we're facing as well. So things like heart disease, stroke, chronic lung disease, Alzheimer's. Again, we see that was like the big finding of the ACE study, was that there was this dose-response relationship between adverse childhood experiences, right? And the leading causes of death, right? Heart disease, stroke, cancer, all of these different health outcomes. And now that we understand that a part of the reason for that link is because of the changes in the brain and in our biology, right? In our bodies that are associated with this overactive stress response.
Yeah, incredible. So clients served by Human Options are themselves often parents dealing with the legacy of their own adverse childhood experiences. And now it's coupled with the challenge of supporting children who've suffered their own traumas. So what do you want them to know? What kinds of interventions and support can we offer these parents?
Well, the number one thing that I want parents to know is that, number one, it's never too late to begin healing from your own trauma that you've experienced and from toxic stress. It's never too late. The number two is that self-care isn't selfish. The most important ingredient for a healthy child is a healthy caregiver. And that really means that for us as parents, recognizing our own history of adversity, our own trauma, our own ACEs, and taking the steps on that healing journey is absolutely critical to providing a healthy future for our kids. So that would be the key thing that I would want people to know, because I think sometimes as parents, we put ourselves last, right?
And I was just going to say that. It's so difficult sometimes to take yourself out of that caretaker role,
Yeah, but it turns out that when we create a safe environment for ourselves, when we take care of our own, mental health and well-being, it turns out that it has a profound, profound impact on the health and well-being of our kids.
Wow.
And so that's the big piece. And I know it's hard to do, but it's so important.
So vital. Put the oxygen mask on yourself first, right? I mean,
that's right.
You say in The Deepest Well that there is something every one of us can do to change the way that we as a society respond to ACEs. And you say that your greatest hope is to inspire action. So what does that look like, doctor? How can it change the way we respond to, criminal justice issues, chronic health issues, just being part of a community at large, I guess?
So there are so many ways, and I have to say that I'm blown away. I am inspired. I just get so excited every day by the work that is happening all over the state, all over the nation, all over the globe. Here in California, we've been really leading the way in responding to adverse childhood experiences and toxic stress. And one of the things that we've done here in California is that we we actually launched an initiative in January of this year to help to train healthcare providers on how to screen for ACEs, both in kids and in adults, right? Because healing one generation is prevention for the next generation, and we are actually paying providers. So for once, this is not an unfunded mandate. We are reimbursing providers on how to screen in terms of for doing the screening, and for and we're paying for training for providers to know how to do this. But here's the thing: we recognize that healthcare alone is not going to solve this problem. And now that California is taking the lead in training our providers how to screen, how to recognize toxic stress, and how to respond with trauma-informed care, we desperately need partners across the state, because this is where the work happens, right? A healthcare provider can screen, can counsel, can connect folks to resources, but we absolutely need the strong network of organizations in our communities who know the culture of our communities, who know the families in our communities, to be delivering that day-to-day care that is really transformative. And I believe that when we do this, when we coordinate our care between healthcare and really take a cross-sector approach to make sure all of our partners on the ground are part of the solution, right? Then I believe that we can cut ACEs and toxic stress in half in a generation. I think we've done it for smoking, we've done it for maternal mortality in California. I believe we can do it for ACEs and toxic stress.
That is so hopeful and ambitious, and I hope that's true. And related to that, we have a question from our silver sponsor, Hoag Hospital in Newport Beach, and they note that, and I'm quoting, "There is a clear disparity in the Hispanic and Black communities as it relates to the pandemic and having meaningful access to care. As you know, Doctor, health equity issues are confounded for victims of relationship violence." Can you share with us how you, as California Surgeon General, are going to address the health equity issues at this stage in our pandemic? How will you advocate for victims of relationship violence and those who are most affected during this health crisis? So that's from Hoag. Doctor?
I'm so grateful for this question, and it's a powerful question. Health equity has been a huge priority for me in my role as California Surgeon General. And step one I want to note is that California recently launched an equity metric that's part of our reopening blueprints. So we have taken, we've made the statement, we've taken the position to say that we see the ways in which this pandemic has led to greater inequities, has had a greater impact on our low-income communities, on our Black and brown communities, on our vulnerable communities. We also, so we want to make sure that our reopening doesn't further those inequities, right? So we have implemented an equity metric as part of our reopening blueprint to say that California is going to have an equitable reopening. And so that is something that I'm really proud of. I think is really important. Another piece that I think is critically important is that as part of the ACEs Aware initiative, as California has invested $150 million over 2 years in training our healthcare providers on how to screen for ACEs and how to respond with trauma-informed care, built into that initiative is a strong focus on equity. And one of the things that we are helping to train providers to understand is that that discrimination is also a risk factor for toxic stress. And that when families and communities experience discrimination, it's harder for parents and caregivers and families and grandparents to be that buffering, nurturing care. It's harder to provide those safe, stable, and nurturing relationships and environments for communities that are facing not only interpersonal, but systemic and structural discrimination. So we build that in. That's part of the initiative. We're really making those efforts.
That's fantastic and so hopeful. If you don't mind, I want to conclude by quoting you back to you. I honestly loved this book so much. You see the pen, I have many places underlined. And one thing I thought was fantastic to end on is, as a quote from you, you say, "I don't think people who grew up with ACEs have to, quote unquote, overcome their childhoods. The first step is taking its measure and looking clearly at the impact and risk as neither a tragedy nor a fairy tale, but a meaningful reality in between." I want to thank you for those words.
Well, thank you so much. It is, it's really been my pleasure. And I have to say that I think that every single one of us has incredible power to be part of the solution. And I'm incredibly grateful for the work that Human Options is doing to be part of the solution, and thrilled to be with you today.
Thank you so much, Doctor. And Marcella, I'm going to hand it back to you now. Thanks so much.
Thank you, Dr. Nadine Burke Harris and Samantha. What an incredibly insightful conversation. You know, a couple of things struck me as you were talking. One is the importance of resilience. At Human Options, we've been really focused on making sure that we understand what the ACE score for every child coming into the emergency shelter or our other programs is, as well as also tracking it for the adults that are coming in. We've really seen that by building resilience is about connection, and it's about having healthy relationships. And we do that through all of our programming. So it's incredibly validating to have you say that. It's also incredibly exciting to actually talk about any adult can be that person that helps another adult through this situation. We can all be what creates change. I'm excited to let you all know that we're very close to hitting our goal. So if you have an opportunity, continue to donate. Thank you so much for being part of this very important day for us, and thank you for your generosity. We know that all of you will go out and help connect victims and survivors to our work and do what you can to create change in the community. Thank you all for being here. I hope you enjoyed our very first virtual event. Have a wonderful rest of the day.
Katie, we want to thank you for carrying on your grandma's legacy and helping us make our first virtual event a big success. Thank you so much for all your hard work.
Thanks everyone for tuning in.
Thank you so much for being here today.
Thank you everyone so much for joining us today. We really appreciate that you've taken the time to do so. Now have a wonderful day. Peace, love, and harmony.